Imagine the sudden, sharp, radiating shock of a toothache. In our modern world, that feeling sends us straight to a sanitized clinic for a quick, painless intervention. But, well, how did humanity cope before such luxuries? Welcome to another explainer where we'll be transporting you across millennia to experience the visceral reality of ancient human survival. Today, we're reconstructing entire human worlds, not through the eyes of rulers or generals, but through the daily experiences of ordinary people, and looking at exactly how our ancestors battled against the darkness of inescapable disease and pain. So let's dive into this intellectual journey. You really have to ask yourself, how did everyday people manage this kind of inescapable dental agony armed with literally nothing but raw ingenuity? We're going to explore how early humans living in these incredibly unforgiving environments confronted a truly universal affliction. Because this wasn't just about simple survival, right? It was about how geography, climate, and the materials they had on hand fundamentally structured their everyday existence, basically forcing them to develop incredibly sophisticated and, yes, sometimes brutal methods of healthcare. Part 1. Stone Age Surgical Masters. Now, we've got to first discard this whole myth that early humans just suffered in ignorance and died young from basic infections. If you trace the path from 59,000 years ago with Neanderthals in the harsh Altai Mountains using Jasper microdrills, all the way to 7,000 BCE in the Neolithic settlements of Mirgar, you're looking at an astonishingly ancient surgical toolkit. These weren't random acts. They were methodical manipulations of the human body, passed down through generations to treat severe pathological conditions. Think about this. A throbbing, infected tooth in 7000 BCE felt exactly the same as one today. But consider the reality of treating it back then. Imagine the sensory experience for a second. The sharp scent of flint dust, the rapid grinding friction of a stone tip being spun by a taut wooden bowstring, and the sheer physical strength required just to manually stabilize a living, breathing patient. These early inhabitants of the Indus Valley endured this incredibly invasive procedure without a single drop of chemical anesthesia. They relied entirely on the courage of the patient and the steady hand of the healer. And faced with such extreme resource constraints, our ancestors adapted brilliantly. Take the 13,000-year-old Repaurophrydian teeth found in the mountains of northern Tuscany. A late Upper Paleolithic healer actually meticulously hollowed out these incisors to remove necrotic tissue. Then they packed the enlarged chamber with a therapeutic conglomerate of bitumen, vegetable fibers, and, get this, human hair. It's an absolutely stunning example of utilizing organic adhesives to seal exposed pulp chambers and stave off fatal infections literally millennia before modern dental amalgam was ever a thing. Section 2. The toothworm menace. Long before anyone had microscopic vision to see bacteria, ancient populations worldwide really struggled to identify the biological cause of tooth decay. And this lack of understanding led to a universal, terrifying myth to explain their suffering. First recorded on a Sumerian clay tablet way back in 3000 BCE, this idea perfectly explains how ancient people conceptually structured their everyday existence and ultimately their pain. I'm talking about the toothworm, a globally held myth that blamed a demonic parasitic entity for boring holes right through the enamel. To the ancient mind, that intense, pulsating agony of a toothache, that was the worm thrashing around. The periods of a dull ache were just when it was resting. It took a biological pathology and translated it into a tangible, physical enemy that they could actually conceptualize and try to draw out. You can clearly see how deeply embedded this dental suffering was in human culture. Look at medieval depictions of Saint Apollonia. Her lore revolves around the violent extraction of her teeth. This kind of imagery really reflects how oral disease evolved from a raw everyday survival challenge into spiritual and religious texts. The fear of dental pain was just so pervasive, so universally traumatic for ordinary people that it permeated their faith, their art, and their entire understanding of divine suffering and salvation. Section 3. The daily grind, hygiene, and healing. As these civilizations grew into complex urban centers, their approach to health naturally shifted to include systematic preventative care. And what's wild is that modern science completely vindicates these ancient practitioners. They weren't just guessing. They observed, and they discovered powerful osmotic binders, analgesics, and broad-spectrum antimicrobials hidden right in their own environments. The Egyptians utilized the osmotic properties of honey to draw out infection. The Greeks were packing cavities with garlic and opium resin, which effectively delivered localized allicin to kill bacteria and morphine to numb the pain. The Maya used pine resin, containing sclereolide, a potent antimicrobial. This was highly rational, evidence-based medicine perfectly adapted to their specific ecological niches. Now, this contrast perfectly reveals how geography, trade, and social hierarchy dictated exactly what ordinary people and the elite put into their mouths to preserve their health. The Egyptians relied on a gritty, abrasive scrub made of pumice and burned eggshells to polish away plaque. Meanwhile, the Romans valued ammonia so highly for its whitening properties that they built a whole trade network just to import human urine from Portugal. Sometimes they'd even mix it with crushed mouse brains. It really underscores the extreme lengths and the massive economic resources dedicated to oral aesthetics in the ancient world. The very existence of specialists like Hesi-Ray, who is known as the greatest of the teeth, proves that the ruling class treated their health as a divine priority, elevating medical practice into an elite science. But we really must remember the ordinary people here. Because while the pharaohs had dedicated specialists, the commoners, who were out laboring on the monuments, were left to rely on the village healers and simple herbal poultices just to survive their extensive, severe dental diseases. 18. That is the exact number of distinct clinical dental remedies recorded in the Egyptian Ebers Papyrus from 1550 BC. This isn't just a handful of old wives' tales, right? It proves there was an immense, organized, and state-sponsored effort to stave off oral disease. They were meticulously categorizing ailments, from throbbing blisters to loose teeth, and systematically prescribing chemical therapeutics. Section 4. Gold, Gems, and Power. As we move into the classical and classic Maya worlds, dentistry actually transcends basic survival and becomes the ultimate display of ostentatious wealth. This stark divide totally challenges our modern assumptions about healthcare. Today, we view dentistry mostly as a medical necessity. But in antiquity, lower classes endured brutal physical extractions without anesthesia, a purely functional approach to pain, whereas wealthy elites transformed their dental trauma into refined, glittering pharmacology. It shows how ancient power was literally built into the jaws of the wealthy. Just observe the sheer metallurgical genius of the Etruscans here. This is a 2,400-year-old gold bridge from Satricum, Italy. These artisans utilized 98% pure gold bands to anchor a replacement tooth to the healthy adjacent teeth. What's incredible is that these remarkable Etruscan prosthetics functioned identically to modern dental bridges, beautifully marrying engineering, jewelry, and early dental science into one elegant device. But the story behind these bridges is even more astounding. Imagine the unbelievable pain and the staggering social ambition required to intentionally remove a perfectly healthy tooth using crude iron forceps with zero anesthesia, just to flash a golden smile at the front of your mouth. It shows how deeply status and aesthetics influenced human behavior, even at the cost of intense, voluntary physical suffering. Let's move across the world to Mesoamerica and see how this concept builds. Classic Maya dentists spun hollow jadeite tubes against living enamel to cut perfect, circular divots. And these flawless jadeite and pyrite inlays weren't just cosmetic. They honored Ike, the divine spirit of breath and life. Furthermore, that medicated pine resin cement we mentioned earlier actively shielded the living pulp from deadly infections, beautifully blending profound religious symbolism with highly effective preventative medicine. And perhaps their crowning achievement, the sheer evidentiary rigor of archaeology, proves the Maya successfully performed endoosseous implants over 1,000 years before modern medicine. They extracted a tooth and immediately inserted wedges carved from seashell valves right into the bleeding socket of a living patient. Astonishingly, the jawbone naturally healed and bonded to the shell, achieving literal bone integration with seashells. They didn't just replace teeth, they tricked the human body into accepting the sea as part of the skeleton. Absolutely incredible. Section 5. The enduring human condition. From the raw necessity of the Stone Age all the way to the opulent ingenuity of the Maya, we see a continuous, living civilization fighting against the darkness of pain. Every artifact tells a profoundly human story. These ancient microlithic tools reflect millennia of courage, adaptation, and an unyielding desire to survive. Every microscopic V-shaped striation left by these flint points on an ancient tooth is a lasting testament to an ancient healer, maybe someone's neighbor or a village elder, trying against all odds to grant comfort to an ordinary person in inescapable agony. So I want to leave you with this final thought. Next time you sit comfortably in a modern dental chair for a routine cleaning, numbed by gentle anesthetics and surrounded by high-tech digital imaging, will you feel the echo of 59,000 years of human agony, courage, and breathtaking ingenuity that brought you there? I really hope this explainer leaves you with a profound new respect for our ancestors, and I encourage you to keep questioning how the invisible, everyday struggles of the past built the exact world we live in today.